The broadcast is now starting. All attendees are in listen-only mode.
Today is our last session for the Diabetes Lifestyle Management series. And I want to thank you for taking the time to review all 4 past sessions. The topic for today are healthy fats and protein. 2 steps toward better controlling your diabetes are consuming healthy fats and consuming healthy protein. While giving this presentation, I want to introduce you to an analogy, or not analogy, but an acronym that I use is called STOMP, S-T-O-M-P. STOMP stands for saturated fats, trans fats, monounsaturated fats, and polyunsaturated fatty acids. Now, healthy fats are important because they help with nutrient absorption, they help reduce the risk of heart disease, and they help to stabilize blood sugar. Like I mentioned, STOMP. Saturated and trans fat are found in processed meats, hot dogs, beef jerky, bacon, and hamburger. Also, baked goods that contain partially hydrogenated oils. And then you have mono and polyunsaturated fats. They are found in fresh avocados, vegetable oils, nuts and seeds, and fish. Let's transition to protein. Consuming a healthy protein option is important because it reduces the amount of unhealthy fat consumed. It also reduces your risk of heart disease. And lastly, it helps to stabilize your blood sugar. The recommendations to get healthy fats should be daily 30 grams. And as you can see here, here are some examples of 5 grams of fat. Examples: 16 pistachios, 10 peanuts, 2 tablespoons of avocado, 1 teaspoon of oil, butter, margarine, or mayonnaise, and 2 tablespoons of half and half. For protein, the goal for protein for males should be 56 grams a day. For females, 46 grams a day. Below are protein serving examples. So you have salmon, 4 ounces, that equals 27 grams. 1 large egg, 6 grams. Half cup of cooked black beans, 8 grams. Half cup of half cup cooked black beans, 8 grams. Half cup of tofu, 11 grams. And a half cup of cooked quinoa, 4 grams. So before I move forward on the goal session, I want to bring your attention to how fat affects your diabetes and how it increases your risk, and how if you are diabetic, it makes it worse. When you're diabetic, or increasing your risk of diabetes is a concern due to also fat or protein, because when you consume protein from animals, you also consume cholesterol or fat. And what's a problem is that fat, when consumed, it has a tendency to affect the process where the insulin connects to the cell, and the fat can cause problems whereby the cell door won't be able to open because of the insulin binding to the cell. And that's due to the fat causing problems right there at the border where the insulin goes to the cell and binds to it, thus allowing the sugar to get inside the cell. So by you reducing animal products, that helps to allow the insulin to more effectively bind to the cell, allowing the sugar to get into the cell. Healthy fats and protein goals. What are your goals for the next couple weeks? One goal is I'm going to consume X amount of servings of healthy fats, 3 servings of healthy fats 2 times this week, or I'm going to consume 4 servings of healthy protein options 4 times this week. And you can include as a healthy protein a vegetarian option, beans, tofu, to help you manage your diabetes, even reverse your diabetes. How confident are you in your ability to achieve your goal? What obstacle or obstacles stand in your way from you achieving your goal? What measures are you going to put in place to help you achieve your goal? And last but not least, let me know. Well, thank you once again for taking the time to meet with me over the course of a couple weeks, from diabetes lifestyle management session 1 all the way to session 5. I hope these webinars enhance your understanding of how to better manage your type 2 diabetes. Please don't hesitate to call me or email me, or even stop by the Health Education Center here in Redlands. Thank you for your time, and hope you have a good week. Take care.